Good day, doctors. I want to go over some simple things that'll help you incorporate active care for telemedicine at home using elastic resistance. So let's talk about that. Number one, when you're using elastic resistance, let's pick the right resistance for the patient, which means when they grab the band and they put it up over their head and pull it apart, it should feel moderate. Now that's pretty easy for me. So I come here and I do that. Oh yeah, that's moderate. So a double green band is moderate. Now, which is telemedicine. How are you going to do that? Most of your patients are going to be in the red, green to start. Some people will be in blue. Now these are the TheraBand colors, and why do I mention that? Because right on the CLX box, it tells you that the green resistance is 4.6 pounds and that the blue resistance is 5.8 pounds. So if you want to quantify it, if you want to document it, there's your documentation. So that's why I'm telling you the TheraBand color scheme. Different companies, different color scheme, different resistance. All I know, it's on the TheraBand box. Makes sense to me. Now, that's how you know if you're in the right zone for them. It should be a moderate resistance, but you're better off starting low and building up. They can always double it. Now that means 4.6 pounds at 100% elongation, going from this to that, all right? As you go to 200%, you get a little bit more, but not significantly. Do not stretch the band past 300%. If they're trying to stretch it more than 300%, then they need the next resistance band, okay? The other thing about bands you need to know is the vector, the line of drive. The force of a band will duplicate the isotonic load of a free weight, okay? I'm sorry, the workload of a free weight. So using elastic resistance will be identical in workload to an isotonic resistance, a free weight, if the force vector is in the right alignment. What does that mean? Let's keep it simple. If I'm doing a bicep curl and I happen to step on the CLX band, I put my hand in it and I do a bicep curl, that's in the vector of the bicep. That's just like doing a free weight, okay? However, if I'm stepping on it with my opposite foot and I'm over here, and this is not the same as a free weight because the vector goes this way. If I really want to make an example out of it, I anchor it to my other hand and I do it this way and my biceps hardly working at all. All right? So line the resistance in the direction of the muscle if you want to get that isotonic type of free weight effect. If you want to get a multiplanar effect, opening up, sword thrower exercise, sword pull, okay? That's multiplanar. I'm doing, and that's nothing wrong with that exercise. Just make sure what you want to do, all right? So that's how you dose your elastic resistance, and that's how you make sure the patient is using it properly. Always recommend they wear eyewear. When you dispense the elastic resistance, if you dispense it in a single pre-cut, pre-boxed piece, there's instructions and there's a disclaimer in there to protect everybody. So always wear eyewear. Now, let's talk about some simple shoulder exercises while I got you here. Let's make it easy, all right? You can take your CLX band in the subacute phase. You can have them do flexion, nice tall and strong posture. Come up, hold, 1, 2, slowly go back down. In a pain-free range. If it hurts here, have them stop here. You can have them do extension. I'm sorry, that's abduction, okay? Just go to 90 degrees right now. Don't go past 90 degrees. You got plenty of work we can do with your patients up to 90 degrees, all right? Abduction and extension, pulling in and pulling back. That's where you need your door anchor. So I'm going to use my cameraman as a door anchor. So my extension is going to just be pulling back to midline, just pulling back to midline, all right? That's going to be extension. And adduction is going to be pulling in to midline. Start at about 45 to 50 degrees and pull in. Always maintain that sagittal plane alignment. Also, maintain an isometric hold at the extremes. 1, 2, come up. 1, 2, come back. 1, 2. Maintain that isometric hold. When the patient can do 3 sets of 15, you can let go of that. Then you can start increasing the speed and do little proprioceptive pumps. Now, external and internal rotation are also very, very important. And external rotation, as soon as the patient can introduce it, would be great for the shoulder. All right? You can do bilateral together, just externally rotating out, or you can just do one at a time, all right, and going out. It helps a lot of times if you put a small pillow, a rolled up pillow or a towel underneath the elbow and pinch it in, because that helps open up the glenohumeral joint space and maintain anatomical neutral. Again, the CLX is great because they can do it with an open or a closed hand. This hand anchors it, and they can turn out. Hold, 1, 2, slowly recover. Nice, tall, strong posture. Turn out, 1, 2, slowly recover. So introduce those as soon as possible. As the patient improves, then you can start to do some horizontal abduction. All right? Then you can start to do some multiplanar work. Cheerleaders, which I'm going to put my hands in here, or sword pulls. They're really the same thing, except sword pulls are one arm at a time and cheerleaders are both the same time. Sword pull, you hold it down and you pull up, and you come down and you pull up. And cheerleaders, you do them both at the same time with a big open hand like you're doing nerve flossing. Anything that's going to strengthen the posterior chain is really going to be beneficial for your shoulder patients. Treat it like it's a upper cross syndrome, like a tech neck. We already did a video on that. So give them the same exercises for now, and you'll be safe, and add these on top of it. So simple things you can do. The other thing with elastic resistance is slow on the eccentric. So don't let it snap in. Number one, your patients will get hurt. Number two, they did no work. They have to resist it on the way in, so they really get the workload. And the eccentric is more tension over time. It's more therapeutically beneficial. So document the exercise, document the number of reps, document the resistance, and document the therapeutic goal. If they're in pain, keep them in a pain-free range, and a good goal would be to improve range of motion, improve the range with 10 pounds of resistance, get them up for 45 to 90 degrees of shoulder flexion, for example. So some tips on rehabbing the shoulder and on the appropriate use of elastic resistance in doing telemedicine. I'm Dr. Donald DeFabio. If you have any questions, just email me. I'm a phone call or email away. And it's been a great day talking rehab, and stay strong. We're going to all get through this together. Have a great day.